Houston has spent most of this year working to limit the spread of COVID-19 as much as feasibly possible. We have operated with a sense of urgency by asking people to wear their face coverings and at the same time engage in social distancing and to use proper hygiene. But even with all of our reminders, it is a sobering reality when you see the numbers, more than 1,000 Houstonians who have died, 15,000 Texans, and over 200,000 COVID-related deaths nationwide. And while the world waits on a vaccine, the city of Houston and our partners have taken innovative steps to monitor the spread of the coronavirus so that we are better prepared to provide resources to communities that are vulnerable and at high risk. Today, I want to highlight the Houston Health Department's wastewater monitoring project, an initiative currently proving itself as a potentially faster method of containing this dreadful disease. In fact, Dr. Peirce in previous press conferences has alluded to it, but today we want to specifically highlight it. This innovative project is a collaboration between the Health Department and leading wastewater and data scientists from Rice University and Baylor College of Medicine. Since May, this team has tested wastewater from the Houston's 39 treatment plants for the presence of the virus that causes COVID-19. That's because people with COVID-19 shed the virus in their waste, feces, even if they don't have any symptoms. Ultimately, the goal is to help develop an early warning system, allowing the health department to identify the city's COVID-19 hotspots sooner and put measures in place to slow the spread of this disease. An important benefit offered by the project is the detection of a COVID-19 resurgence if it were to occur. It offers us a more cost-effective option to mass testing surveys and information on how the virus is affecting areas of our city with limited viral spread. Overall, this project ensures Houston can determine where the spread of this hotspot is with data that can serve as another tool to identify disease, slow the spread, and save lives. The method of recognizing the degree of the spread and where is especially important when fewer people are opting to get tested. I now want to introduce Dr. Peirce, who can talk about it a little bit further, and then he will be bringing up Dr. Lauren Hopkins, the Chief Environmental Science Officer with the Houston Health Department. Dr. Peirce.
Thank you, Mayor, and I just want to say what an honor and a delight it is to be able to participate in this announcement today. As the Mayor pointed out, we have been sort of teasing the public a little bit with our reference to the wastewater project that we've been working on. One of the things that I wanted to stress is that while we have been working on this for quite some time, as the Mayor pointed out, and this is a very collaborative effort with our colleagues at Rice University and Baylor, we have been striving to make sure that this is accurate and factual, because this is what we have strived all along to do, is to provide the public with accurate and factual information. And so we could have talked about this a lot sooner, but we needed to make sure that what we were going to be talking about, that we had all of our I's dotted and all of our T's crossed. And we feel that we're at that point today. You will have seen in the national media some reference to wastewater projects going on across the country. And those are great and wonderful, but we have been doing ours here. I would like to boast and brag, and maybe somebody up here will correct me, I think we've been doing it longer and to a greater degree than others, and so that's why we believe we have greater confidence in the results. We'll also give a little bit of context. We have talked all along about positivity rates, new cases, the number of deaths, and other hospitalization numbers, and these are all metrics that we use to try to give us an idea as to what is going on with the virus in our community. And each one of those metrics has its strengths and its weaknesses. And Dr. Hopkins is going to come up in a minute with her team and describe to you what is unique about this wastewater project. You will be able to quickly recognize how it has strengths that other tests don't have, and it's going to help us answer a lot of very important questions very accurately and very timely. And with that, I just want to thank the team I want to thank Baylor. I want to thank Rice University. I want to thank all of our folks at the Houston Health Department for all the work that they've done in bringing this together. With that, Dr. Hopkins, you tell us what's going on.
Okay. Thank you, Dr. Peirce. So the Houston Health Department took on this work to assist us in tracking the virus across the city in time and space, and use that data coupled with the clinical case data to inform public health interventions. Along with our partners, engineers at Houston Water and academic experts at Rice University and Baylor College of Medicine, we've been collecting this data, analyzing it, refining methods, developing best practices, and interpreting the results for the past several months. Today, we'd like to share our findings. As an overview, infected persons, asymptomatic and symptomatic, shed the virus in feces. Feces enter the sewage network. Wastewater is collected at the treatment plant before it's processed in an aggregate sample. And that sample is analyzed for COVID-19 virus. And the results of that could be either positive or negative, is the virus present or not, or better yet, a quantitative assessment. How much virus is there if they do find it? The clinical data is highly useful, but is limited by the people being tested at any given time, whereas the wastewater data provides insight of the virus for a snapshot in time for the entire population. In Houston, there have been times, not recently, but there have been times when we've seen 5,000 clinical tests for COVID-19 per day. And this is compared with 2.1 million people covered by our wastewater treatment system. Because we sample at the same time from multiple locations, and we do this sampling regularly, we can compare the virus load in the wastewater treatment plant residential service area to other residential service areas, and also we can compare the virus load in a particular residential service area to itself in time. This means we can tell which parts of the city have higher virus loads per person and which have lower, and the trend in the virus load in time. Together, we've made a tremendous progress to the extent that we're producing data that we are more and more confident in, and using the data in weekly decisions on where to deploy Houston Health Department strike teams across the city to control the virus. This is a map of the 39 wastewater treatment plants. They vary in size, covering 670 square miles. The zip codes within each service area are also shown because we implement the wastewater treatment plant findings on the zip code level. 24-hour composite influent samples are collected from the 39 wastewater treatment plants each week. And those samples are split between Rice and Baylor laboratories and delivered to them in replicate. Each of those laboratories analyzes the virus, and the labs provide the virus per liter, the virus count per liter. Using this analysis that's conducted very carefully with the best practices that the team has developed over the last months, all to increase the confidence in the results. And Houston Water provides the flow rate for the data for the day of collection of each plant. The count per liter is multiplied by the flow rate to get the virus count per day. And our statistical model considers the replicate results from both Rice and Baylor. It's run separately, considering the Rice data only, and then again with the Baylor data only, and then jointly to arrive at an estimate of the total viral load in the community in copies per day for each location each week. The health department then uses that information of the viral trend and magnitude at each wastewater treatment plant service area to inform where to target the public health interventions. This is an example of output from the statistical model that the health department uses to understand the week-to-week trends in the virus load from each wastewater treatment plant. So here you can see all of the wastewater treatment plant names in the left-hand graph, and next to the first wastewater treatment plant is the name FWSD number 23, which is Fresh Water Supply District number 23. And it's green, and it's the highest on the list, indicating The green bar indicates that it's a statistically significant decreasing trend in virus load at that location for that week. And the rate of the decrease is higher when the green bar is longer. So for the gray zone, there is no statistically significant trend. And the red, unfortunately, means that the virus is increasing at a statistically significant rate for that week. So we use this week's information, and we also determine if the direction of the trend was consistent with the week before, and then we record the trend by the zip code. So this slide provides an example of two specific wastewater treatment plant service area viral trends. And above the trend plot, the associated clinical cases within them from August 7th to September 14th. So the trend plot shows log copies of virus per day on the y-axis, and the date is on the x-axis. And what you can tell from this is that the White Oak Bayou has a lower concentration level and decreasing trend. Both of these plots show decreasing trends. And Keegan's Bayou has a higher concentration in viral load. So if you look at those wastewater treatment plant outlines with the case data, you can see quite a few more cases occurring in the Keegan's Bayou wastewater treatment plant than the White Oak. And so this would indicate that we would prioritize interventions in Keegan's Bayou over White Oak in this scenario. So this slide provides an overview of the virus across the city. The graph on the left depicts the trend of each wastewater treatment plant service area. So you see lots of lines on the graph on the left, and each one of those light lines is the trend for each of the 39 wastewater treatment plants. Every plus mark on each of those lines represents a sampling event, a model output for that week, which is the combined results of Rice and Baylor's data put into the statistical model, every one of those little pluses. And then taken together, the average of that trend is the solid green line. On the right is the clinical case positivity rate data for the 14-day moving average for the same time period. And the blue pluses on the right graph are the actual positivity rate data for that day, and the blue line represents the whole trend of those positivity rates. So when we examine the wastewater treatment plant trend in viral load together with changes in the observed clinical positivity rate for the region, we see a high correlation between the two series. As a matter of fact, it's at 97%. And this indicates, a strong simultaneous correlation between the two measurements. This is what is giving us the confidence that we have in the data. And here's an example of that same type of analysis comparing the wastewater virus load trend to the clinical positivity rate trend, but at the wastewater treatment plant level. So in this case, you're looking at the wastewater treatment plant called Southwest and the wastewater treatment plant called WCID number 47, which is Water Control and Improvement District number 7. And you see another correlation between the two trends that is very strong. So these plots are created weekly, and the information is taken together with the positivity rate and put into a cluster analysis for the Houston Health Department strike teams in order to determine where to target the interventions. What you're looking at here is a variable list of what goes into the cluster analysis. And you can see the two main sources of information that have to do with the COVID virus right now are the positivity rate data and the wastewater treatment plant data. So through the hard work and dedication of city scientists and engineers and experts from academia, Houston's made significant strides to quantify the virus, statistically interpret the findings, and apply the information. And as Dr. Peirce alluded to, and to my knowledge, no other city has such a robust system for collection, to analysis, to intervention in space and time. And no other program like this is run in principle by the health department within that city. And continuing the tradition of health department scientists working closely with Houston academic partners, we're especially fortunate to have these expert engineers, statisticians, and medical research to collaborate with as we work to control the virus. Baylor and Rice, in the beginning of this project, came to us volunteering their support and help. And this longstanding tradition of working with academic partners has really proved well and is obviously really important in this serious pandemic time. So I guess now I want to have Dr. Stadler come up and speak about her role in the project. I can't emphasize enough how important this team has been and how hard they continue to work on this. And I'm sure she'll provide some insights for you.
Thank you. Thank you, Dr. Ron. I want to start by thanking the City of Houston, and specifically the Houston Health Department and Houston Public Works for their support of this important and timely endeavor. I got involved in this project initially because my laboratory at Rice specializes in research on wastewater. Usually when people think of wastewater, the immediate reaction is yuck. So I was thrilled that this project was able to shed light on the incredible value of studying the stuff that goes down the toilet. My research group was poised to investigate the presence of the virus that causes COVID-19 in wastewater because we routinely study pathogens and the microbes in wastewater. When the pandemic hit Houston, we quickly shifted to looking for the virus. We were able to rapidly set up and help set up this system for collecting samples from sites all across the city, distributing those samples to 2 laboratories, and analyzing those samples to understand how the virus was spreading throughout the city. This was only possible thanks to our amazing collaborative team consisting of health department folks, Houston Water folks, our collaborators at Baylor, and many, many hours put in by students and staff. This incredible interdisciplinary team was able to innovate and improve methods in real time so we could reliably detect low concentrations of the virus in wastewater samples collected all throughout the city. In addition, thanks to Dr. Kathy Enzer and her invaluable team of statisticians, the data that our group and Dr. Moresso's group from Baylor generates each week is translated into actionable information and trends that was and continues to be used by the health department to inform their interventions. And I think what really sets our project here apart is the fact that we're monitoring at 39 different sites. So we have information not over just time, but also over space. The wastewater monitoring system that we implemented here in Houston will not only keep our communities safer during this unprecedented pandemic, but also will make us better prepared to respond and to contain future epidemics. I'm grateful for the City of Houston's support of cutting-edge science and innovation, which enabled us to help respond to this. And with that, I'd like to introduce Dr. Anthony Moresso from Baylor College of Medicine.
Thank you, Lauren. I'll just echo the thoughts with thanks to the mayor and the Houston Health Department and our Rice collaborators. And I'd also like to point out some people at BCM Taylor Labs, which helped spearhead this project, Drs. Terwilliger, Clark, Drs. Piedra and Avenhula, and technicians Geraldo de Santos Hernandez and Cal Wiesner. I'll just end by telling a little story because everything's pretty much been said expertly. And that story is that this is not the first time that Houston has suffered a major infectious disease problem. It may not be the last either. In 1962, a young virologist at Baylor College of Medicine named Joseph Melnick started to sample stool and wastewater to look for another disease. That virus was polio. Many of you are, I think, too young to realize this. Even our great mayor is probably too young too. But in the 40s and 50s, polio would ravage Houston. And it was not really explainable, but Houston accounted for about a third of all polio cases in the state of Texas. and was a seasonal hotspot for polio in the country. The interesting thing about polio was that it too was shed in wastewater and in excrement. And Dr. Melnick realized that you might be able to sample this to get ahead of polio outbreaks. And when he was surveying in the spring of 1962, he started to see polio in the wastewater, and he made a decision to push the administration of the oral polio vaccine, which was just recently developed, up from the fall to the summer. And that effectively prevented the polio outbreaks, and we haven't really had them since. You may recall the Children on the Iron Lungs. That was in the Texas Medical Center, a fledgling medical center at that time, hundreds of kids a year, and we haven't seen that since. And that is because Dr. Melnick realized the importance of getting ahead of the outbreak by taking samples like wastewater where the virus was shed. The SARS-CoV-2 virus also shed in wastewater, and so we could learn from this lesson of history of the importance of doing such measures for public health interventions. And I'll stop and turn it back over to Dr. Pierce.
All right, before we go to questions, I want to give a shout out to, we've mentioned, but probably not enough, is the work and the collaboration with our partners with the Houston Public Works. Because we could not have done this, and they've done a lot of work, and I just want to make sure that we recognize Houston Public Works for all the effort that they put forth in this.
As of now, what we do know is over 200,000 people have died as a result of this virus, more than 15,000 Texans, and more than 1,000 Houstonians. So please take this virus seriously. The testing sites are now open. We closed for a couple of days because of Tropical Storm Beta. But as of yesterday, those testing sites open, and they are open today. So please get tested. Thank you all so very much. Appreciate you. Thank you.